Welcome to episode 41 of Accessible Finance, where we demystify personal financial topics and answer your questions so you leave saying, I get it now. I'm Eric Johns.
And I'm Rachel John.
Let's dive in.
All right, Eric. So we are on part 3 of our retirement series.
Yes, ma'am.
For those who have not been watching in order or seeing the other ones, part 1 went over when can I retire and how should I think about it. Part 2, we got a slightly more granular and talked about phased withdrawals from accounts, when you should do them, how you should think about that.
Okay.
So today we're really going to start looking at Medicare, IRMA, and the different parts and when you should be enrolled in each.
Right.
Where do you want to start?
How do you think about health insurance? And really, a big part of this is going to be Medicare for most Americans. If you've worked for 40 quarters, then you're not going to be paying additional premiums for Part A, right?
Do the 40 quarters have to be consecutive?
No,
Okay.
no, total. Um, so that's essentially 10 years, right?
In the workforce for 10 years. So like
Correct.
if I worked for 5, took off for, I don't know, to watch some grandkids and then went back
Right back.
again. Yeah.
We're gonna try to zoom out, but there's a little bit of granularity here. And we want to kind of make people familiar at least with what Medicare is, right? It's a very complex topic with tons of rules and exceptions to those rules. We're just going to try to paint a broad picture so that going into retirement, you have some idea of what you should be thinking about in terms of your health insurance, specifically Medicare.
And I think some of what makes it a bit more convoluted is that the majority of people looking to clarify what Medicare is for you are salespeople.
I mean, that's true.
So
That's true. There are actually, we work with individual brokers. There are brokers that are paid by the insurers um, directly. So they're not going to really, well, they're going to earn dollars, but it's not really going to increase your premiums. So that's an advantage for you.
yeah, I liken that
So
similarly to
you
like the
still got to find an
people.
honest one though. You're still going to find people
Absolutely.
that you trust, right? So
And who can explain what you're signing on to, like to you effectively.
correct. And
It
to be
is
clear,
very
we're not brokers. We do not
correct. You
broker
don't
health.
sell.
We don't sell insurance of any kind,
Correct.
just to be clear. All right. So Medicare, what is it? And when should I get on each part? Okay. So part A is typically referred to as hospitalization. All right. And it's going to be completely free if you've worked for 40 quarters. Okay. 10 years, working in the United States, paying into Medicare insurance.
Mm.
Part A is free, right? And it's going to cover hospitalization, um, skilled nursing care, nursing facility care, hospice care, and home health care, right? So it's typically referred to as hospitalization. There's almost never a reason to not participate in this at age 65. So when you're eligible to participate in Part A, you probably should, okay? Because it's not going to cost you anything
Right.
and the insurance is viable, like it's good insurance, right? So when you typically hear Medicare, most people are referring there again. There's Part A, and then there's Part B and D, and B and D are going to you're usually going to get on them both at the same time.
Okay.
Okay, you're going to be eligible at 65, and then you need to enroll either at 65. I think it's within 9 months. It's like the 3 months before, the 6 months after. Um, yeah, so there's an initial enrollment period, right? So you either do it right when you're 65, or there's a special enrollment period, which can be following a separation from creditable coverage from an employer plan, 8 months after the separation from service, um, or from the employer health insurance plan termination, whichever's first. Okay, so the point here is that you're going to want to do this if you're not employed, you're definitely getting on it at 65. And if you are employed and you're paying a significant amount of dollars in premiums, right? So maybe your employer doesn't cover they definitely don't cover 100%,
Yeah.
and maybe even their 50% coverage is requiring you to pay maybe $1,000 a month from your own checks. This is almost certainly going to be better. Maybe not $1,000. We don't want to quantify that, right? Because we're spitballing here.
That's what I was going to say. How would you identify like what the threshold is? Like what are at least you may not be able to quantify, but what factors should you be considering when you're looking at when to enroll in Part B?
That's a good question. That's a great question, right? So first, am I enrolled in an employer plan? If the answer to that question is no, if I don't have health insurance that I really like, then you're almost certainly going to be on Medicare. So what you hear a lot, we hear a lot, is, well, I don't want to pay the IRMA brackets,
Yeah.
right? Like I'm in a high IRMA bracket, I'm in a high tax bracket, and therefore I don't want to pay these IRMA premiums. And for most of you listening to the show that don't work in the industry, you're like, what in the world is
Probably haven't heard it.
IRMA? Did he make up a word? What does it mean? Okay, so it's an acronym, right? And it stands for Income Related Monthly Adjustment Amount. And it's essentially the government asking people who are earning more to pay more into Medicare health insurance. So the flat rate for married couples that are making $206,000 or less, or individuals making $103,000 or less. So let's just round down. So individuals making $100,000 or
Right.
less,
Or couples
married
of
couples
two.
making $200,000 or less, you're going to pay $175 a month. Okay, we're rounding. It's 174.70.
This is
You
for
pay.
Part B?
This is for Part B, correct? Exactly. Right. So you're going to pay that for Part B,
Okay.
and you're not going to pay any surcharge for Part D if you're within those parameters. Okay, so 100,000 or less, individual,
Mhm.
200,000 or less,
So Part D is
married.
just kind of like lumped in with that Part B.
Correct.
Okay.
For those individuals. Now, and then as you go up, so what are these IRMA brackets? The IRMA brackets, the second bracket goes from 100,000 to 129,000, and then you would pay an additional like $75 a month almost. It's 245 a
Yeah.
month. And then it goes to 350 a month, 450,
Yeah.
560, and then almost $600 a month.
Spitballing, it looks like every additional, at least until you get like really high up, it's like every additional 30,000 or so that you add starts to tack on an additional premium.
Right. So the point here is that Irma is kind of the boogeyman, right? And a lot of clients are super
I agree.
averse, right? Like to paying any extra dollars to the federal government, as you might expect. Nobody's super excited to go and hand over more of their paychecks, more of their, hard-earned nest egg to the government. However, when compared with the marketplace insurance, not even just the market, when I say marketplace insurance, I'm really actually talking about the broad market, but there is like actual federal government there's a marketplace to go get insurance through the federal government,
Mhm.
right? But if we're talking about the broader insurance market and you're just looking at all private insurers that you have access to that are not Medicare, okay, that typically you will pay more for less coverage. Typically, I'm not talking about like, well, I have this grandfather plan that has special exceptions and my employer pays all this. Okay, but maybe there's a lot
There's
of
exceptions
granularity.
to every,
We're just trying to
yes.
we're trying to articulate for you that if you are in the highest IRMA bracket, so you are a married couple earning above 750K or an individual earning above 500K, okay, you're in the highest IRMA bracket, which means you pay $600 a month for baseline Medicare. All right.
And that is the capped amount. Like it could not ever be higher than that
Correct. You're
600.
going to pay $600 a month for
Currently.
Medicare, and then you pay an additional $81 surcharge for Part D.
Okay.
So let's call it like $700 a month. All right. You pay $700 a month for your insurance, and then you're probably going to go ahead and get what's called Medigap. So there's additional layers to Medicare where you go and get supplemental coverage to alleviate some of the portions of Medicare. Like, so Medicare has 80% will be paid by the government and 20% will be paid by you for all of your care with no cap. There is no maximum out of pocket. So the theoretical out of pocket maximum is infinite. If I needed infinite health
Okay.
insurance, 20% of infinity is still
Really high.
infinity,
Yeah.
right?
Right.
Like um so the idea is some people aren't comfortable with that and they want to shift that risk off to the insurance company. Right. So in shifting that risk, private insurers have come up with ways for you to do that. So there's Medigap, which you'll hear to as standard letters, like Medigap G, right? Plan G. And that means all private insurers that you have that are selling you Plan G all have the same exact specifications and parameters and coverage. They have to. That's what the federal
That's
government
what
has. That's the
defines it.
arrangement
That's
that
what
they
makes it
have.
G. Yeah.
That's what makes it Plan G. Then there's what's called Medicare Advantage, or sometimes referred to as Medicare Part C. It's not really Part C, it's just Medicare Advantage. So private insurers can have Medicare Advantage, and the variance there is enormous, right? Those are the ones where like the ex-football players will come on TV and say, oh, Humana has this really great Medicare Advantage package, yada, yada, yada. Like we have free YMCA or free Ochsner, fitness
Yeah.
center, whatever you're going to do. So um, the point here, one of the points here to make, one of the takeaways, if you leave with nothing else, leave with Medicare, even if you're paying IRMA premiums, is still very good coverage and still very likely worth it for you. So when you say worth it for me, how do we know? Like, can you kind of ballpark for
Yeah.
me a dollars per month premium that I would be paying? Okay, so if we're talking like Medigap Part G, okay, you're typically going to be in the ballpark of $120 a month. Right? And then it's about $80 a month for like a prescription coverage package, like an overage for prescription coverage. Does that make sense at all? No, not really.
Okay. So let me first,
Sorry, there was a lot
yeah,
of information that was just
let me see if I can try to
thrown at you
synthesize
guys.
what has been said so far. And then I feel like we need a bit more clarity
Okay.
around um everything relating to Medigap.
Got it.
So Part A,
Yep.
right, which was that hospital insurance, is what we are stating highly, highly encouraged to be enrolled into at 65, particularly if you're not working.
Hmm.
Um, and that is free, automatic,
If you've worked for 40 quarters, yes.
correct, or 10 years.
Yes.
And it does not need to be consecutive.
Correct.
Perfect. Parts B and D, you're likely to enroll at 65 as well. You would compare it to your current plan.
Correct.
If you have a workplace plan that is covering your insurance completely,
Right.
you're probably less likely to do
To want to
that.
go and pay some premiums. Correct.
Right.
And then you can just enroll when you separate from service from that employer,
Correct. Okay.
or the
Perfect.
employer terminates the plan.
So parts B and D are ones that the amount that you're paying monthly is tiered based upon the income that you and or spouse have, that your
Bring in.
household has.
Correct.
Okay.
Yes.
Um, with you.
Can I have a brief side note there?
Sure.
It's a little granular. The number that we're talking about is not just AGI, it's a modified adjusted gross. So they add back municipal bond income because they
Oh,
don't
okay,
want
okay,
the
okay.
ultra wealthy being like, well, I don't actually have
That's
to pay
okay.
taxes at that rate.
Okay, yeah, okay.
So I don't actually take in $500,000. I actually only earned like 100K, but I have like 700K of municipal bond income.
So there's no
Nope.
artificial
It's
deflation of
harder to
your
do at
income.
least.
Okay.
Yes. Sorry, go on.
No, that was helpful actually. Um, but even if you're in the higher IRMA brackets where you are paying on the
Uh-huh.
higher end, it's still potentially significantly more beneficial than what you might find on the marketplace. Especially looking at age, medical stat, like they factor in all of these things that typically the older population really struggles to be able to say,
Correct. That's
we're
exactly,
super
yeah,
insurable.
exactly. The
Yeah,
least insurable age group. And if you think about it, right, like all of us who are working and paying FICA taxes, the
right.
Social Security and Medicare portion of that, are going towards funding Medicare right now. So we're all funding Medicare. And then even when you're retired, like you're still going to be funding, like,
Correct.
or you have funded Medicare for your whole life,
Yeah.
right? So, like, this is a heavily subsidized insurance program through our taxation and Medicare taxes, right?
Yeah.
So,
Good point.
we would hope that the coverage is decent, and we would hope that it's going to be slightly cheaper than what private insurers can provide, or else the
Okay.
government is just that
So
inefficient.
to that end, though, when you're saying you have to have worked 40 quarters or 10 years, it has to be 40 quarters at an employer that has taken out
FICA
FICA
taxes,
taxes.
correct?
So that would be the majority of places, but it just wanted to clarify that if
Yes,
you if you worked
correct. If
in
you're
a, in
paying
a
in
cash
cash,
only
yeah,
business,
yeah, yeah. You're gonna have a bad time when you try to
they
go
don't
do
know
this.
who you are. Okay, perfect. So then when you were talking about Medigap,
Hmm.
first of all, before we get into anything, like I'm on board with plan A, plan B, plan D. Now I'm looking at either this like Medicare Advantage, which you said
Or
is
one of
like,
the letters.
right.
Yeah.
Now, who wants that? Like, why would I want that versus being happy with A, B, and D? Like, what type of individual would be looking for Medigap versus not?
Right. So an individual that essentially doesn't want that wants a limit on their out-of-pocket maximum per year for starters.
Well, I mean, I think everyone would want a limit, right?
Sure.
So, like,
And is willing to pay a little bit to get that limit.
okay.
So
Well,
that's
so
that's part
I
of
guess
it.
it's really
So typically what happens, like rule of thumb, general, like, how do you think about it is Medicare Advantage is typically going to be like the higher deductible health plan. So it's going to be cheaper or free, right? And then they're going to alter your coverage in some way. And the out-of-pocket maximum is going to be like a higher number. But you might have, you know, no copays and like very little out of your pocket or nothing out of your pocket, or usually you will have copays actually. But the point is, the coverage is going to be you're going to pay less in premiums, right? And then you're going to receive less good coverage on average. Does that
okay.
make sense? Less services covered for you in full on
So it's
average.
more of like your bargaining.
Yes. And then higher premiums, higher coverage are going to be Medigap plans, specifically like Plan G is going to cover basically everything.
I was going to say, correct me if I'm wrong. My understanding is that Plan G is kind of the gold standard for
Yes,
like
they used to have
premium.
correct. They used to have Plan F. My understanding is that that's no longer offered, and it's been replaced with Plan G. Plan G has I think that Medicare has a deductible, their annual deductible. I want to say it's $240. I don't have that information in front of me, but I think it's that. It's a nominal amount, really,
I
like
was
in the
gonna
grand
say, is
scheme
the
of things.
annual deductible? That's
Annual deductible is you pay.
amazing.
So with Plan G, you
Mhm.
pay your premiums, which we'll talk about that when we quantify like your totality of healthcare coverage, right? What does it
Okay.
cost total for me to be covered by health insurance when I'm
Sure.
65 or older if I opt into Medigap on Plan G, Plan D and then Part A, okay?
Yeah.
So um Plan G will say, like, what do Medigap plans do? They come in and they say, you pay us a premium, a monthly premium, and then we're going to supplement your coverage so that it's not just like an 80-20% anymore.
Got it.
Does that make sense? So Plan G covers really after you pay the $240 deductible, you
Mhm.
no longer pay anything else other than the premiums. So Plan G will cover all of your doctor's visits, right? Like all of your testing, all
Now,
that kind of
being
stuff.
that this is the, premier plan, I
Yeah,
would
it's like a
imagine the
Cadillac.
premiums are relatively significant.
You would
Like,
think so.
I would.
They're
I
not.
do. So why are we not all in G? Well,
We
not we, but why are all why are all qualifying individuals
I
not in
ask this
Plan
question
G?
regularly. I don't know, because their budget's very tight, and or they were, allured by the some of the fringe benefits that Medicare Advantage plans have to offer. I don't know.
So, okay, just to touch on that really quickly before you delve into that, when you're talking fringe benefits, because the Medicare Advantage is the what you were saying, you see like the NFL,
Yeah,
ex sports athletes and
yeah,
whatever coming on saying, like, I get to go to Oshner for free, I get to do
right.
whatever, right? Um, so they have the like shinies,
They're trying to give you something, and they're saying that it costs nothing, right? So, like, their expectation, presumably, is that they can pocket more from your lack of usage of their coverage than you're going to be getting out of it.
right?
Does that make sense? Because they're still like the government's going to be paying for the 20%, the 80% of the coverage
Okay,
for everybody. Does that make sense? And their arrangements with the private insurers, I can't really speak to, or we can't really
sure,
speak to.
right. Okay.
But our understanding of the rule of thumb is that Medicare Advantage, lower premiums, lower levels, lower coverage, right? But it's still going to be significant. It's still Medicare is still going to be good. Is kind of the point of this
Yes,
whole episode.
right,
Is Medicare good? Don't just stray from it because you've heard Irma's the boogeyman or it's terrible, and you don't
right.
you make 100 like $700,000 a year, and so you think that this $600 a month Irma premium is going to eat you alive.
Alternatively, don't, yes. Alternatively, don't stray from it because it's such a convoluted beast
Right.
that is
Right, right, right. There
honestly
are
intimidating.
brokers and agents that will work with you, right? And so we would sit down
Mhm.
with the clients, with the brokers and agents and talk through exactly what's going to
Correct.
happen to make sure it's exactly as the client
Correct.
envisions.
Any
So they're comfortable.
comprehensive financial planner should be willing and able to do
Yeah,
that.
to engage with you in that way.
Um, and I think that this is an area that I would encourage people to talk to. Like, if you talk to a broker and you get this weird slimy feeling, talk to a second. Like,
Right.
find someone you're
Yeah, find somebody
comfortable with.
yeah,
Yeah.
exactly correct.
Yeah.
I like that a lot. So what is this ballpark going to cost me? What is
We're talking Part G.
we're just going to assume that the individual is 65.
Yep.
They're trying to get onto Part G. They're enrolling in Medicare. That's not optional. And then I'm sorry, that it is optional. You don't have to enroll in Medicare, but Medicare has to accept you if you've worked for that amount of time, right?
Correct, correct. So, like, you're automatically a shoe-in for Medicare.
Right. And you go for this additional coverage, right? And then the cost for G is $120 a month. And then it's gonna be like $80 a month for a lot of the prescription drug programs. We're gonna round, so we're gonna say it's 120 for Medigap, and then 80 for like additional prescription drug coverage. Okay, that's gonna be an additional $200 a month.
So we're saying that like your Part G would be about $200 a month as a whole?
Part G is 120, and then the it's Part D like supplement is gonna be like 80-ish ballpark.
Okay, we're saying that the majority of people would probably.
You're gonna want some kind of prescription drug coverage as well, and like that's heavily customizable based on like what pharmacy you use,
Oh,
what
Part
prescriptions
B.
you have. Yeah, you're gonna want a broker you're comfortable with because they're gonna ask you for a list of your prescriptions, right?
Yeah, you're gonna get really intimately familiar with them. Okay, perfect. So if you're talking 120 for Part G,
Mhm,
you're talking 80 for your supplemental Part D.
mhm.
So that's 200 there, right?
Yep.
And that is in addition to,
You're like call it 700 if you're in the highest IRMA
right, I
bracket.
was gonna, exactly. We're talking the
Yeah.
Cadillac of,
So call that what, 900?
yeah,
900?
a month.
Correct. In premium. But if you compare that, if you look at what
I
you're
was
paying
gonna say,
plus
if
what
you
your
look at where
employer are
else is in the
paying,
market.
that very well could be cheaper and the coverage is almost certainly better. You're not going to find a plan with a deductible of $240 and a maximum out of pocket of $240 for under $1,000 a month. That does not exist,
Ev-
especially at age 65.
I was gonna say, even
I
us,
won't exist for me at age 38, so it's certainly not going to exist for
yes,
anybody at
for
age
us right
65.
now, even like as we're looking at,
Correct. It
you
costs
know,
significantly more than that.
yes, you recently actually, side note, Eric was just recently looking
Yeah,
through
shopping around
a
policies.
variety of insurance policies as well. So you are very well aware of what it would cost for
Mhm.
like, people our age.
Yeah.
So you've got, I mean, we're going to be cheaper to insure than somebody who is 65.
Mhm.
So to be able to have that kind of coverage for that price is
Yeah,
amazing.
exactly.
Medicare better still be around when we're ready for it.
Right. So essentially, that's the takeaway, right? Is even if you're in the highest brackets, Medicare is good coverage, and you should get on it, right? And it's daunting. There's a ton of information,
Yeah.
right? There are exceptions to all of the exceptions. It's similar to the tax code. It's very convoluted,
Yeah.
but you can and should participate in the process, and it makes sense for you to do so in most cases, right?
Yeah, exactly. And so then by following through with that plan, right, you end up having part A, which is your hospital,
Yep.
part B, which is your like doctor, medical care, that kind of stuff, right?
Yeah.
Um, part D is your prescriptions.
Yep.
And in this plan that we discussed, it's less than $1,000. It also included an additional like prescription. Uh,
Drug supplement. Yeah.
yeah,
Supplemental coverage.
exactly. Supplemental part
They
D.
have all kinds of tiers and everything. We're not going to really get into that.
Yeah. Then it also had the Medigap Part G, which was the most comprehensive. There's a bunch of charts that you can go and look at online that compare the parts. And it's the one that has the most check boxes.
Yeah.
It's the most comprehensive. So with all of those pieces in there together at the like highest income thresholds, to be
Mhm.
very clear, it's less than $1,000 a month. So it only gets less expensive if your income is
Right.
less
So
than
if
a thousand.
if you've set up your retirement accounts in a tax efficient way and you've done a lot of planning around this, and maybe you're a married couple and you make less than the 200,000 threshold, then you might just be paying the 175 a month plus 200 a month, right? 375 a month, and you have complete medical coverage with a
That's
$240 deductible.
crazy.
So that's quite cheap.
Yeah,
That is very inexpensive.
yes. And in order to be in the most tax advantaged position, there have to be moves you're making prior to
Right.
retirement to prepare yourself for that as
And
well.
typically, if you're like, well, what are those moves? Like, what are you talking? You're kind of burying the lead or whatever, right? Like, so the the biggest thing to think about is most of America will just stuff money in the 401k,
Yeah.
right? Which is a tax deferred account. Now, when you hit 65, you don't have to take money out of it, but if you're used to living on 200k or more, maybe you spend 300k a year and all of your money's in a 401k, well, I got to pull that 300k a year out of it,
Yeah.
right? So that's not even to say that that is definitely wrong. It's just it's a question of what's right for you. And I know that's a
That's what I think
yeah,
that it's really highly
everyone loves to hear
situational.
it depends, but
It is highly
unfortunately,
situational, but I think that that is part of why working with people who are, 5 years out from retirement is so exciting because there's
it's
so
so
many
much fun to
decisions.
do. It's
Yes.
super interesting.
And because every single decision you make is so very impactful,
Correct.
like more so than
It's fun.
any other. Yeah, exactly.
It's fun.
Exactly. Um, but yeah, I mean, if there are individual case circumstances or questions that you would have, we would welcome those to be sent
Sure.
to us.
Right.
So yeah.
All right, guys. So if you enjoyed today's episode, please review the show. And if you have any topics you'd like discussed or financial problems you would like solved, reach out to us at podcast@equilibriumfp.com or visit our website at equilibriumfp.com. I can't speak.
Struggle a little
I
clear.
can't speak. I'm sorry.
Not enough coffee.
All right. Well, thanks, guys.
Till next time.